After successfully curbing the spread of the feared coronavirus COVID-19, the government is now confronted with a different challenge. The new challenge comes in the form of imported virus infections. From the 150 COVID-19 cases confirmed yesterday, 97 are overseas returnees, with 92 being returnees from Kuwait and 5 are arrivals from Chennai who are being quarantined at the facility in Katukaliava. The remaining 53 infections are confirmed as naval personnel. Meanwhile, among the 34 COVID-19 cases identified today, 15 are arrivals from Kuwait and another 15 are arrivals from Dubai. Accordingly, from the 466 persons repatriated from Kuwait who are currently under quarantine, 321 have so far tested positive for coronavirus. In such a backdrop, some Sri Lankans who are employed in Kuwait are urging the government to send help from Sri Lanka by way of a medical team. Meanwhile, responding to questions over government stance on repatriation given the current spike in imported cases, Cabinet co-spokesperson Dr. Ramesh Patirana had this to say.
Have you taken a decision, the government or cabinet to take a decision not to expect it further Sri Lankans back to Sri Lanka?
We have not taken any decision as such. The government will ensure all the Sri Lankans, those who want to come back to Sri Lanka, will be brought back to Sri Lanka. But for that, we need to take more precautionary methods. As we have seen, significant number of returnees are infected with COVID-19. So we will take necessary measures to ensure that we quarantine them properly, for which we need space. A long process, it takes about 14 days. Government is carefully looking at that situation and will draw up a plan to ensure that disease would not spread in the community because of the people, those who return from other countries.
The highest number of COVID-19 cases reported in the country is from the Navy cluster, and the total number of Navy infections reported since the 22nd of April now stands at 693. The overall figure of recoveries among naval personnel rose to 357 today, with 13 sailors being discharged from hospital. Meanwhile, with the detection of a COVID-19 infected sailor yesterday from the Navy-owned Gafoor building in Fort, 200 Navy personnel attached to the building were directed for quarantine. With the new detections, the overall figure of the country's COVID-19 infections stand at 1,503 and 748 among them are active cases. Meanwhile, the country's COVID-19 recoveries increased to 745 today, having risen by 13. The island nation reported 10 deaths owing to the virus, and most among them suffered from underlying health conditions. Barring the naval cluster and the infections reported from the batch of repatriations, there haven't been any locally transmitted cases of coronavirus in Sri Lanka for the past 28 days. Meanwhile, the Director General of Health Services, Dr. Anil Jasinghe, has issued a series of guidelines for a new way of life in order to prevent the spread of COVID-19. These guidelines are issued for the general public in an array of sectors and activities, including the use of taxi services, public transport, fitness centers, tourism and hotels, funerals, public meetings, seminars and workshops.